Hi guys, this is Cristian from ArtSmiles, and I'd like to explain a few things about the post-operative care for patients who's got implants and bone grafts. Okay, just a reminder for today and tomorrow. Please remember, do not spit, and if you need to spit, please just wipe the area of the wound with a tissue, okay, and just to take out the blood clot. But don't spit. Please avoid spitting and avoid drinking with a straw. Please avoid smoking. Actually, I always ask my patients who are smokers to stop smoking 2 months before and keep not smoking for 2 months after the surgery. Smoking can cause problems for the healing of the bone around the implant, and you may lose the implant in the very beginning. Another problem with the smoking, in the long term, you may lose the bone around the implant, and you may have problems called peri-implantitis. It's inflammation around the implant. So please consider stop smoking if you are a smoker. Please keep your fingers away from the wound. Okay, don't try to test to see if it's painful or not. Just leave it there. Please don't stretch your lips to see how's the healing, because once you stretch the lips, the wound may open, okay, and the stitches may open, so we don't want that to happen. Bleeding is totally normal, so please understand that in the first 2 days it's going to bleed a little bit, okay. And if you have any bleeding, you can use a gauze, like I'm saying here. Let's say that we did the surgery here. You just put the gauze there and wait for 30 minutes to stop the bleeding. About swelling, it's normal to have some swelling the first 2 days. I usually prescribe medications, a bit stronger medications, when I realize that during the surgery we're gonna have some swelling. Usually when we do bone graft, or more when I need to open the flap, open the gum to do the surgery, I prescribe a bit stronger medications just to prevent the swelling. But anyway, even with the medication, even with the more conservative approach with the surgery, sometimes some patients may have some swelling. It's just normal part of the process. So to prevent any swelling, please use a pack of ice. The ice pack must be on for 20 minutes and 10 minutes off. 20 minutes on, 10 minutes off. Please avoid putting too close to the ear, otherwise you're going to have pain over there. All right? Directly into the wound, and 10 minutes, 20 minutes, 10 minutes off. In the first 2 days, the more ice you do, the better. The better for swelling and for the pain as well. It helps with the pain as well. Your diet must be soft and cold. Please avoid any beverage or any meal that is hot, okay? Another thing is just avoid nuts, especially if you've done a surgery in the lower jaw. The nuts or anything that is crunchy can go into the wound and create an infection if it stays there. If you see that there is a rest of food in the wound, especially when we do surgery, when we do extractions, if there's a rest of food, you need to rinse it out with saline. Saline could be saline, or could be warm salt water as well. Your oral hygiene, especially when we do implants and bone grafts. If I had to open the gum, let's say we did a bone graft in this area here. If we've done a bone graft in this area, okay, please avoid brushing this up to here, from the midline to here. Avoid brushing. Don't brush for 1 week, okay? Why? Because if you brush, just the fact of retracting the cheek to brush, to clean that area, it's going to create a tension in the wound, and it may open. Okay, we don't want to have any problem there. For cases like this, I usually do I'll do this recommendation for some specific cases. It's not for everybody. If you notice that during our conversation after the surgery, I explained that to you. So what you need to do is you don't brush that area, and you're gonna do you can brush the rest of the mouth. Let's say if you did the surgery here, you're gonna brush just the other side, and you're gonna do a rinse 3 times a day. For 1 week, you're gonna rinse your mouth with Savacol. Okay, Savacol is digluconate, chlorhexidine digluconate, and there are different brands in the market. Savacol is the most well-known in Australia, and you can do the rinse for 3 times a day for one week. The rinse should not be like this. Okay, don't brush like this because it could dislodge the blood clot. So put in your mouth the mouthwash and just leave it there for 1 minute. That's it, and then you can spit it out. Sutures, we usually remove the sutures. Sometimes I do flapless surgery, not always, but sometimes I do flapless surgery, and so we don't have surgery. We don't need to remove any stitches in cases like that. If I did suture the case, we usually take out the sutures between 1 and 2 weeks. For bone grafts, sometimes I leave for 2 weeks and 1 month. Okay, depending on the case. Bone graft material. Bone graft, it's when we do a bone graft, it's normal to see some particles of the graft coming out, because when I do a bone graft, I place the bone graft, and on top of the bone graft I place a membrane. This membrane holds the bone graft in place, but some particles are a bit loose and they go away from the graft, and it's totally normal. It's not a problem. If you see 2 or 3 little pieces of graft coming out in 2 or 3 days after the surgery, it's totally normal. You don't need to worry about that. Okay, my concerns about the surgery in general. Okay, in general, if you after 4 or 5 days, if the pain that was wearing off starts to peak again, if you have pus coming out of the area, fever, and if you're not feeling well after the 4th or 5th day, please call our office. I'd like to see you. Sometimes it could be all of these are signs of infection, and I'd like to see if everything is good, if we need to change the medication, if we need to do something to help you. When we do an implant, most of my cases I place a healing abutment. Healing abutment is an abutment, is just a piece of metal that I put on top of the implant, and this is to promote the healing of the gum. So it's going to be, you're going to see the healing abutment. Usually we have different colors. It's for different implants. Could be yellow, could be blue, could be purple. Okay, and it's normal to see this sometimes, to see this piece of metal. Okay, and this is just to promote the healing, and after 2 months, when we're going to restore the implant, then we're going to remove that healing abutment and place the implant. And the crown usually is placed between 2 and 4 months. Usually 2 months after the implant placement, we do the scanning for the crown. About the medication that are necessary for the surgery, we usually prescribe medication before and after the surgery. The antibiotics is very, very important. You should not skip the antibiotics. This is to prevent any infection around the implant. We have a very high rate of success with our implants, but mostly because we are very careful with all the steps of the surgery, and medication is very, very important. If you skip the painkillers, the problem is that you're going to have pain. But if you skip the antibiotics, you may have a failure with the implant. Okay, it's very rare, but you need to be mindful of taking the antibiotics. Sometimes I prescribe dexamethasone as well as part of our medication. This is anti-inflammatory that prevents the swelling and helps a lot in surgeries like implants and especially bone grafts. Okay, and medication for pain, we usually prescribe normal painkillers. In more complex surgery, sometimes we go with a bit stronger painkillers. Then it depends, and I'm going to discuss each case with the patient and decide which medication we're gonna use. And one last piece of advice: please avoid doing activities for 1 week. Okay, avoid going to the gym, avoid doing too many exercises, especially in the first 2 days. These are the most important. Please just go home, have a rest. If we had a simple implant surgery, just one implant, if that surgery took 20 minutes, 30 minutes to be done. So usually this is a minor surgery. This is usually the recovery time is much easier than taking a tooth out. But if we did 4 implants, 5 implants in the same session, or 2 or 3 implants with extractions at the same time, so you need to be mindful that you need to take a rest. You need to just rest for a few days, and then you can return to your normal activities. Okay, thank you very much for watching. If you have any issue, please call our clinic. I'd like to see you and help. All right, thank you.